Statewide and West New York officials gathered at 5800 Jefferson Street on Friday morning to let seniors know about a program where they could safely get rid of their expired prescription medications. Project Medicine Drop, a statewide initiative that allows people to safely dispose of their expired medications in order to curb the recreational use of prescription drugs, takes place tomorrow in West New York. Police Director Robert Antelos, Mayor Felix Roque, Special Agent of the NJ Division of the DEA, Carl Katowski, Assemblywoman Angelica Jimenez, and NJ Division of Consumer Affairs Acting Director Steve Lee were just a few officials who spoke their minds on the subject. Elaine Pazicki, the chairwoman of Partnership for a Drug-Free New Jersey, told a heartbreaking story about how her 32-year-old son Stephen succumbed to drug addiction.
I want to share with you some information on why it is so important to limit the access to prescription medication in your home. My beloved son, Stephen Michael, was taken a few months before his untimely death due to addiction to opiates. He was 32 years old. Let me tell you a little bit about my son. He grew up healthy and happy. He was an altar boy in our church. He received an award in middle school for being the nicest student in the class because he was always compassionate and looked out for the underdog. He volunteered at the Matheny School and Hospital for the severely mentally and physically handicapped. This nightmare began after Stephen was prescribed a very potent opiate, Oxycontin, with refills, after each of 2 consecutive shoulder operations while he was in college. It was at this time that he became addicted to opiate pain relievers. Stephen then began to lose interest in school, and he no longer enjoyed the activities that once gave him such pleasure. Stephen withdrew from his family and friends. He now had new relationships, his new friends, those who used or could get him his desperately needed drugs. He was clean for over 2 years when he was released from the last rehab he was in. But one night he succumbed to his addiction and accidentally overdosed and died in his bed. It was a mental addiction at that point. The first year after my son's death was the worst experience of my life. My very soul wants to reach out and cradle this one who is gone from me forever. The pain is unbearable, and yet it is born to be endured.
Additionally, Hudson County View spoke to Roque, also a doctor who specializes in pain management, after the event concluded. Important event for not just seniors, but really the whole community. So can you just tell me a little bit about today?
We have all the agencies, including DEA, public affairs from the state. Education is very key to our community. We're actually informing the residents and seniors that how to dispose their medication. We're making available locations where they can dispose of their used medication. And this topic is very dear to me, John, because I am a doctor specializing in pain management. In my field, we deal with a lot of patients in pain, chronic pain, patients that are on chronic pain medication, narcotics, and those are the people that actually have issues with medication. And some of them, they have children in the house, they don't know how to dispose of these medications properly, so we're giving them an avenue so they can know how to dispose of their medication. And again, this is all about, working with the community, educating the community. We're working with them.
A Project Medicine drop box will be available at the West New York Police Headquarters, located on the left side of Town Hall at 428 60th Street, tomorrow. I'm John Heides with the Hudson County View, the eye of the community.